Uh, just Doctor, let me introduce you here for our students and our doctors. Okay, just 1 minute, and after that you can start.
Please.
بخیر هاتن براستی تقریبا تمکی درێژە مە دەست پێکرێ بە سمینار یە ڕۆژی بەردەوامی وێ پرۆژەیە سمینارۆکە ئێرۆ تێداین جادی دکتۆر عباس منصوران سەر کیمیکال ویپنزە یعنی سلاحên کیمیاوی کو بکارتێ دکتۆر عباس بۆخە ئایمونۆلۆژیست و باکتریۆلۆژیستە ji Swêdê دکتۆر تۆ هەگەر کەرەما خۆ کاربی دە 45 دقەدا سمینارە خۆ پێشکەش بکەی باش دەبێ it's you and stage.
Okay, thank you, doctor, and hello everybody. Sorry, I understand Kirmanji, but I'm not familiar with it. So I hope to learn it. And thank you for this opportunity. And I say hello, havalan, salam alaikum. As a health care professional, it is essential to have a general knowledge about the chemical weapons. So it is to understand what is the factors that, for example, hazards, properties, exposure, symptoms on site, and as you as a doctor, so, and the professionals in healthcare treatment and decomposition. I try to go to this critical points. So generally, the purpose of this the criterion. Chemical weapons intended to purpose of the in war against the people as Turkey use or so it's a concept. So chemical weapon is a compound that used intentionally to death or harm the enemies or the other side in the war. So can be toxic chemicals and can be in ammunitions or devices or equipments directly in connection with munitions and devices. The three, so it's considered as the chemical weapon. So the toxic chemicals and their precursors. So it means that the definition of it is any chemical which through its chemical action on life process can cause death, temporary incapacitation, karai, or permanent harm to human or animals. I don't know, is it possible, Dr. Haidar, to translate or to briefly to tell what he did?
No problem, doctor. Finally, I can translate your speech in about maybe 5 minutes to Kormanji.
Okay, thank you. So I try to define the definition of the toxic and poisons, the two different things. Toxin is defined as the poisonous substance produced within living cells or organism. For example, a bacteria have toxin, like Staphylococcus, Streptococcus, tetanus, Clostridium, or something like that. The poison that comes from the living organism is called toxin. But poisons are substances that cause harm or to organism, to a living creature. So it calls the poison. So as you see, the devices and the minutia so release toxin to death the people. So as I mentioned, equipments directly in connection with weapon, munitions, for example, bullet or something like missiles and devices, all called the chemical weapons. So we divided these, it is divided, the chemical war agents, to 4 different categories: organophosphorus, OP, organosulfurs, organofluorine, like arsenical and compounds like that, and the others. Chemical weapon agents used, as I mentioned, in warfare are classified in four. When from comes to the against the human, the first category called choking agents that cause the pulmonary or respiratory tract system is choking. Vesicles agents that cause blistering. I don't know, in Kermanji maybe it's called towel or something like that. Blood agents that cause damage the blood cells. And the fourth one in nerve agents that cause the nerve system. And the route control agents like tear gases, pepper gases, and something like that. And the psychomimetic agents. But the fourth one is the one choking, vesicles, blood agents, nerve agents, the most important that we try to explain now. As you remember, this Haval from guerrilla from the mountain that were attacked 2 years ago by the nerve agents, the chemical by Turkish. So the seven Haval, so they were attacked by the gas. So as I mentioned, the four different agents, most important agents, choking, that respiratory, here you have it, and the blister that come from the skin. There you have blisters, and blood agents that attack the red blood cells, and the nerve system. So this is choking agents that cause the respiratory tract. So the most important examples of the chemicals are chlorine, chloropicrin, and diffusion and phosgen. These four are, so phosgen can also cause the other damages in the body, but they mostly cause the respiratory tract system. So as I told you, chlorine, Cl, chloropicrin, PS, diffusion, DP, and phosgen, CG. And all these four disposed as gas. So I try to talk about the phosgen. Phosgen is very, very dangerous. There is no any treatment. Phosgen exists in gas form at room temperature and suffocating, can cause choky. It's called also choky gas because of the stop the respiratory tract to work. So they used in during the World War the First, and irritate, can burn the skin and eyes, breathing, irritate the throat, respiratory tract, and cause death. So the patients or the victim, when exposed to phosgen, may irritate the eyes, burning throat, vomit, coughing, foamy sputum from respiratory tract, foamy, kafalud, breathing difficulty, and chest pain. And if they be severe can slowly suffocate, or khafegi in Farsi, in an agonizing death, very, very painful death. So decomposition, how to we decomposite the fusion or this group. Do not spray water on a leaking cylinder. Do not spray water on it. Turn the leaking cylinder with the leak up to prevent the escape of gas in a liquid state. So there is no antidote against fusion toxicity. If somebody of the victims of by fusion, there is no antidote. So we must help the victim and manage for the suppurative to help, for example, to breathe, to help and to clean from the chemicals. Blister agents, the most common chemical weapons agents are blister, cause blister, so that can damage the respiratory tract, also skin, and irritate the other the throat, and so blister agents can be as liquid from the missiles, aerosol, vapor, and dust, sulfur mustard, khardal, nitrogen masters, levisite, and fusion, as I explained, they can also cause blister, not only respiratory, but also the blister on the skin, towel. As I mentioned, can be as vapor, as gas, for example, as dust, and different things. This nitrogen, nitrogen masters, levisite is the most dangerous one that Russian used to kill the enemy by this levisite. Later I try to explain about this one. So nitrogen master is very, very important, that was used by Turkish army. Treatment. There is no antidote for this group, as I told you. So it's important that the first involved to the decontamination, to clean, irrigation by water, removing the victim from the source of direction immediately, and move the patient, the victim, from the area, and airway management to help that to breathe by the respiratory tract management, to prevent the relief of obstruction of the respiratory tract. So it's important. So the emergency response recommended that these, because there is no antidote for these gas. Levisite, as I told you, levisite was used by the Russians, is an organic arsenic containing war gas, so can cause blister or vesicant, towel. So there was a chemist, professor and chemist or scientist, that asked refuge to America, to USA, and disclosed this levisite that was produced by Russians 1983 and 1982. So it is they used in Iran-Iraq conflict also this sulfur mustard, not levisite. Levisite was a terrorism chemicals that was used by Russians to the enemies. So this is blister. Blisters that comes from this levisite can easily penetrate ordinary clothing, even from the cloth, penetrate the cloth and cause these blisters can kill the victim. So it is very very important that how to help these people. So another agent that's is very important, the blood agents. Blood agents, so dispose as gas, the method of the to how disperse. So hydrogen cyanide, cyanogen chloride, and arsine are examples of the blood agents that destroy the blood cells. When blood is destroyed, blood cells cannot carry oxygen to the cells, to brain, to heart, to different part of the body. So it causes the death of the victim. So an example of this blood agent is cyanide, cyanur, hydrogen cyanide, cyanogen chloride. So potentially deadly chemicals. It's very rapidly can act and kill the victims. Interfere, as I mentioned, with the body ability to use oxygen. So there is stopped the oxygen to carry to the cells. As I mentioned, can dispose as gas. So absorbed through lungs and skin, even when you have clothes, inhibit the cytochrome C oxidase enzyme, damage vital organs. The most important organs are brain, lungs, heart cannot have oxygen and blood. So cyanide or cyanur can or produced by some bacteria, fungi, and algae. Cyanide is found in various kind of plants also, seeds, for example. All the fruit that have stone, including bamboo, including almonds, bitter almonds, badam tal, the heaven tal, apples and peaches seeds. So it's important to not to eat the bitter almond, have cyanur. Treatment for cyanide exposure. So we have antidotes for a cure. We can cure it. So you need to read to find by the specialist how to do it. And hospital cares for emergency personnel by suppurative medical care, for example, to give the oxygen, maybe needs to open the airway, intubation, and others. So another chemical weapons that used agents, that's arsenic. The arsenic is it's a metal. Arsenic containing chemical warfare is something between metal and non-metal. So it's used with other metals. For example, arsenic used mixed with cadmium, a metal, with chromium, with lead, sorb. So with mercury, Hg. So to be more harmful and deathful, arsenic can cause lung and skin cancers also. So the fourth agents, nerve agents that damage the nerves from the brain and the other the nerve system is very highly toxic. For example, sarin, suman, tabon, VX. These four group. They can be in liquid form, can be in aerosol form, can be vapor form, can be as dust, gard, غبار. The disposal method. Very, very rapid effect on nerve. So Syrian government used sarin. Iraq, Iran, and Turkey use all these sarin, suman, and tabon. I think that they used against our Havalan in mountains, in Zop and Matina and other places. So the five nerve agents, very important to know about these. Taban, GA, military called GA, sarin called GB, soman called GD, and cyclohexyl sarin, GF. And we have VX, very, very toxic. And all these four very important to know about it, how to manage. So sarin, NATO designation, so or NATO mark called it GB. So it's very, very chemical, long name. Appearance looks like is clear substance, colorless liquid. So there is no color, there is no, so it's very clear, very extremely toxic and synthetic. They can make it in industrial system. One of the most toxic nerve. So exposed sarin can cause death in minutes, 2 minutes, 1 minute, depend on the sarin, how much is used to, and it's important to know about the so in minutes can kill the victims. Attack the nerve system, as I told you, blocking the acetylcholinesterase activity. Acetylcholinesterase activity. I will later I explain a little more about it. Can by inhalation, by ingestion in the stomach, skin, eye contact. So it is by these ways the roots of exposure, how human exposed to this. As I mentioned, liquid, aerosol, vapor, and dust. So there are three series: G series, V series, and A series. Levisite that Russian used to kill enemies, for example, persons that escape from Russia and in London and other places, they by the agents, spions, they kill the victim by the Levisite. So we have J series and V series and A series. I haven't it A series here, but later maybe have it. So causes accumulation of neurotransmitters between nerve cells, and the synapses can be blocked and leading to hyperstimulation of muscles. So like here we have axon of a nerve. Here we have the uh, uh, receptors. Here, the synaptic cleft here. We have dendrites here, dendrite, and axon. Axon have trans neurotransmitters. These green ones stop. They are neurotransmitters. That by this transmitter, so we can move our. So it's different transmitters. We have maybe more than 100 transmitters. The most important that they give them the message contact to each other, send them signal to each other by these gates, by this receptor. When so the toxin, the nerve agents, chemical that I mentioned, um, so this group comes to uh, accumulate, cannot pass from between axon and dendrite. So we have no control on our muscles. The victims, it's a very uncontrollable movement of the muscles of the uh, fiber cells. So the neurotransmitters examples, for example, different serotonin, epinephrine, dopamine, glutamate, glycine, and different things. So we have very different, but these are very important to have the to pass stop the toxin, stop the nerve to work to pass the, for example, serotonin. And the organophosphorus nerve agents, as I mentioned, all can be cause this blockage of the transmitters. So effects, how they affect overstimulation of parasympathetic system effect of the peripheral and the central nervous system. For example, lacrimation, the eye tears, salivation, sweating, blurred vision. I translated blurred vision means ditena sherin, yeah, something like that. I don't know. It's maybe it's mistake of a translation. Headache, difficulty in breathing, and vomiting. So cause seizures, loss of body control, muscle paralyzed, and unconsciousness, bihushi. All this is a nerve system picture. So the nerve, all nerves connected to different organs. So it means these agents, the chemicals they use by Turkish, for example, enemy, they use these to cause the damage of all these systems by nerves. Another one example of these agents, chemicals, someone. I told you that this compound, the vomiting compound, someone is a vomiting compound, and the different name of the other chemicals, chemical warfare that damage the nerve agents, nerve system. These nerve agents, chemical warfare nerve agents, such as suman, such as organophosphorus, inhibit the the nerves to send a message by accumulation of these acetylcholinesterase enzyme. So cannot pass the transmitters, nerve transmitters, so cause the damage of the nerve to send message to different organs, like here. So we cannot contact between brain, between nerves to these all organs. All these chemicals are banned, forbidden to develop, produce, stock, transfer, and use by law. But Turkish, as a NATO member, so use all these weapons, the Chemical Weapons Convention, CWC, Chemical Weapons Convention by United Nations, all are banned, forbidden, but it is very, very usual for Turkish authorities to use it against Rojava, against the people. So treatment and antidotes of these nerve system agents. So it's important to know about how to, for example, sarin should quickly decompose it or decontaminate, to wash, to remove from the body, remove the clothing, washing the skin with soap and water. And the treatment, diazepam, 5 to 10 milligram in adults, and 0.2 or 0.5 milligram per kilogram in children. So to control the convulsions, control the convulsion of because it's, as I told you, that the muscle cannot be controlled. So these two, diazepam and atropine, is used by this. So this another drug, another agent, A series, as I told you, G and B series, so it's the A series agents. Novichok also. Novichok is a Russian name. Is newcomer. Is a new chemicals that was produced, developed in this age, 1970, by a scientist that asked refuge to United States and wrote a book. Can use some use binary chemical weapons mixed with other metals. Some are solid at room temperature, and others are liquid form. Novichok is very, very, very dangerous and deathful, this one. Newcomer, new agent. So it's called A series agent. The scientist's name was Will Mirzayonov, that wrote a book 2009 and showed how they and by the Russia to as a weapon. So it is it was disclosed for how they manage it, how they produce it. Treatment, there is treatment, atropine as quickly as possible, under 2 minutes after attack, or some hours, 1 hour, 2 hours, is not more. So can be cured, the toxicity of the so it is antidotes. Atropine is an antidote at the Pazar, something like that. So all the soldiers and guerrilla hope to have this kit with themselves to use the auto injection. They can use it, auto inject, and very, very so it is not cheap to have it. It's very geran. So we have the Mark 1 kit, Mark 2 kit, and diazepam, as I told you, in the kit. So it helps as an antidote against this. As I told you, auto injector. So it is very important, that is familiar for us, especially Dr. Haider, when there was in 2019 October attack by Rojava and Sarakani and Gillespie. We were there, and white phosphorus. It's white phosphorus. So white phosphorus is a white to a little yellow transparent waxy crystals, a solid, not liquid, not vapor, as a solid. Chalk-like, like chalk, gach. A waxy is used in many military munitions, mixed with other things. Turkey mixed these with other things and attacked by artillery, by bombs, by grenades, by everything. So as it is the missiles that contains phosphor, white phosphorus. It's white phosphorus. Another photos of white phosphorus. It's forbidden according to the convention of the United Nations, but Turkish authority army used, as you know, used in Sarakani's occupation. When we were there in Rojava, when Dr. Haider, we moved from Qamişlo when the area were under attack, to Tel Tamer, and then to hospitals of the Hasake with and Dr. Roger, Dr. Masuma, and we were there to help the people. Attacks were done October 9th of October 2019. So the Turkish invasions of Rojava begins with bombing of Qamişlo and Sarakani and Telespi. And so we first at the time, it was the first time that we considered when we examined the patients, the victims. So in Hasake Hospital, so we found that the feature of the injured was very different from the other physical agents. Most of the victims were civilians, so all had been, all the bombs were dropped from drones, and most patients have mentioned that they had 2 strikes, not only one, by bombers. So the fourth different from others, that there was no visible blisters. There was only a hole, a little hole, and black holes penetrating deep into the skin. Some victims complained of a sensation of a foreign bodies in their eyes. And as I told you, the lacrimation, tears. And the lesions were severely, very, very painful, necrotic. The coal tar-like pigments on their bodies. No sign of shrapnel injuries, but there were extensive closely clusters. I'll show you later what I mean here. Some patients, some victims had breathing problem, difficulty, and the body were covered by dust, black dust, like charcoal dust. So we helped them remove the cloth and washed the victim's body. The first thing that we must do to remove the phosphorus. Phosphorus particles burn when contact with oxygen. When there is no oxygen, so goes into the body, penetrate to the very, very deep. When there is no oxygen, so it stopped to burn. So how we did it to help the victims? Victims, all noticeable particles were removed with forceps, and all slow skin was debrided. So I explain what I mean by debriding. It is a patient that I remember with Dr. Haider, we were there in the hospital, Haseke, the first days. So we managed to remove the particle, remove we debride the dead cells of the skin. First, we must wash, we must debride, because there is very, very easy to be to the growth of the staphylococci, streptococci, pseudomonas, E. coli, and different bacteria. So it is very, very important. You see, here is, I showed it to reporters, so to the that how we must debride to remove here. It's very important. It's very as a important. That I learned from Swedish department that they used the vinegar, apple vinegar, 3%, 3% apple vinegar. Apple vinegar is the best choice for pseudomonas. It is painful for the patient, but we must first to help by this. I did it. It was very painful, I knew, but the only choice that we could remove all the bacteria. So you see here all the black coals color, and from all the body burned of the white phosphorus. He was 30 years Mamusa. He could survive, fortunately, after all these wounds, and this was for us, this was very important to cure it, and fortunately he survived. You see the color. So all these penetrated all these by the white phosphorus. I remember the reporter. He was very, very kind and very experienced people. One, Antoni Yod, was very famous. He was in Palestine, and with a group of the Times reporter, he was there and documented all these criminals of the Turkish authorities. Is another patient that you see, the black spots like charcoal. Here, unfortunately, lost the right hand. And here is the sign of the white phosphorus. Here we have skin has turned all black, you see, like a plastic burn on the body, on the face. Here we have the same patients, how we manage to debride, to clean, to wash. It's important for the wound not to use alcohol, not use the other the methods that kill the cells, skin cells. We must, with sterile water, with soap or something like that, washed 4 or 5 times by sterile water, and then remove all these debris. The patient that it was very documented in the ward. And here we have Dr. Haider, the upper part of the body of the victims was burned by the white phosphorus of Turkish army, drowned in October 2019. So he survived, fortunately. So here the last, we must remove all these to remove the bacteria, because this necrose skin cause the good place for growth of the bacteria, so it can kill the patient. Here we have another patient that is, fortunately, he survived. Evidence of the Turkish crimes in Rojava. So I think it's, I am finished with slides. If Dr. Haider hope to explain for us a little more about this chemical agents, and hope to can continue maybe in some other opportunities by Dr. Akram and other doctors that are here. And so to have the more details of the treatment, how we help the victims, and it's important to be continued by the more details. Thank you for your patient that listened to and allowed me to participate and talk with you. Thank you much.
Thank you very much, Dr. Abbas, for your nice presentation. Honestly, you remind me a terrific memory about Serikani and Gillespie events. Anyway, let me translate your speech to Kurmanji in maybe 3 or 5 minutes, and after that, maybe we have some questions. Disam Tembash, as a Kurtasi, تشيكو هات كوتن بكرمانجي ببيجم فقشتي دكتور بحث خبولو قلت وكو بسبوركي باش تندرسي قادة تندرسي براستي بيويسته هيا آستك آگاهی مثل و مسئله سلاح کیمیاوی به چه جوره او نه هيا اگر تشيك به رنگی چه بو هم چاوایی کاره بین تفگر بکن تریتمنت یا درمان چاوایی یا حتی دیکامپوزیشن یا خونسا کردن و تونکردن او ماده کیمیایی به چه شیوازکی به چند ریباز بکارانی جبر کو تقسیم بکا سلاح کیمیاوی یک ریباز او لگوری کیمیکال استراکچر یا منظمه کیمیاوی او مواد کو دبون 4 گروپ ارگانوفسفوروس ارگانوسولفور ارگانوفلوراین and arsenic هر وها لگوری physiological effect او باندور که سر لاش تکن ولو تقسیم کرد که گفت ایجنت یا او موادن که چوکینگ بون سر پالموناری سیستم یا پرگال بهنه باندور دکن زیده وزیکانس یا بلیسترینگ که زیده سر چرمی باندور دکرن بلاد ایجنت بون هر وها نرو ایجنت بون و سایکومیمیک یا سایکومیمتیک که زیده باندوری که نفسی یا سایکولوژیک چه دکن که گروپن وزیکانت و نروز یا عصبی هری زیده تین بکارانی ده گروپ چاکینگ ایجنت دا کمه گود زیده باندور دکه سر ریسپیریتوری سیستم و به تایبه سر او کیسن الوئولی چند میناکانی وکو کلوراین و کلوروفیکرین که اونا فسفاروجینن به تایبت اعراض یا سیمتوم که جبونا آنی زمان وکو کافین یا کوخین بو بهن تنگ دبی و لوی داره به شکل شوات هیا که هر وها اگونایزینگ دیف یک چه تایبتمندین و گروپو که یعنی مرین چه دبی بس مرینه که پر به ایشه براستی که مگود دکاره صدم پالموناری ادما چه ببه حتی انفیزیمیا جبو تریتمنت براستی انتیدوت یا درمانه که جبو او تونه و حیا کو ام دکارین پیویس آوه بکار نینین دما کتشه گولو مدید بس دکارین آلیکارین دستویک یا ساپورتیو ام بکارتین گروپ دین بلیسترینگ ایجنت بو وکو سولفور مستارت که اوناش دکار زیده ذاتن سر چرمی باندور دکن حتی سر چاو و سر سینگ یا لانگز دکارستن باندور بکن دی سال لوی گروپیش دا انتیدوت یا درمانه که دیجه او تو نبو دیسا هم مجبورین جه آلیکارین دستپیک استفاده بکن گروپ بلاد ایجنت بو که زیده هیدروجین سیاناید بحثا او کرد که سیاناید تایبت باندور دکه سر انزیمک بناوه سایتوکروم سی اکسیدیز جبوویه که دما که باندور که سر او اکسیدیز ایدی اکسیژن ناگه اندامن وکو برین وکو لانگز و هارد او جی صدم دبه که رپیدف یا مرینه که پر بلز چه ببه سیانای دیدی گود ده باکتری ده هی فانگای ده هی حتی پلنت یا نبات که ام بجین هی وکو بهیو تعال جبو تریتمنت ده سیانای ده باشی وکو ایدی هندک انتیدوت سے تایبت یا درمان تایبت ہے کو مروف دکاره بکار بینه بحث آرسنیک کرد وکو نرو توکسیک کو دکاره باندوره کی بلز بکسر پرگالا عصبی و هر وها تایبتمندی دین او بو پر کانسریس یعنی سرطان چه دکاده لانگز و اسکین دا بحث سارین و سومان کرد به تایبت سر سارین پر سکنی کو دکاره به شکل گاز انکو لیکوید به او نرز ایجنت زیده صدم دبن کو ده سیستم عصبی دا وکو پارالایز چه ببه و به تایبت بلاک دکن چه بلاک دکن او ترانسمیتره کو ده سیناپسه دا بو تایبت سر انزیم اسیتیل کولین استرایز کو ناهل او انزیم ده سیناپسه دا هاتو چوب که جبوی بگشتی کاری بو ادولید و به تایبت ادوله نکوده رسپیریتری سیستم ده های پارالایز بکا بده سکنندن ذاتن جبو تریتمنت اوجی آنی زمان کو هم دکارین وکو کار دست بکو کن جل همو در بخین و اکسیژنیت بکن یعنی اکسیژن بدین به تایبت بحث دو درمان که دیاسپام و اتروپین او دو درمان هم دکارین دوی روشه ده بکار بین بحث نوویچوکس کرد که وکو دی ایجنتی که روسیه زیده دوی داره در کد وکو اوجی براستی دکاره خطری که پر زیده بکار بینه بحثا واید فوسفورت کرد لوی داوی دا که مدید زیده قلاو کرد که سریکانی دا چاوای هاتی بکارانین و سیستم او کدام کتشک ببر رنگی بو چاوای چرم پاکش که این زیده بحثا او کردم باشه الکحول بکارنین جبر که خلی یا سلز دشوتینه ده گوری تجربه که بود دوی دممه اپل وینگر بکارانی دی نظام چیه تفاح تبجن هم تشي هات بوتن حياة في مرحلة أبو هجر برسك وهاي كرم بكن نظام برسك بيشنيارك تشي وهاي اگر تو نه نزان باکو از پرسکی کرم کن پرسی وای کرم tamam. Doctor, we have a question.
Yes, but I didn't hear.
Okay, I can repeat the question. And the question is that in some situation where there is no possibility to transfer the injured people to the hospital, what do we do? For example, you have talked about situations in the mountains. In such situation, what do we do?
Yes.
As a general, yes, you talked about some treatments and some methods for prevention more dangerous, but you can, if possible, give us a summary.
Yes, the most important you have a cover your hand, have a then remove the clothes, all the clothes of the victims, and wash it by water, but open the mouth to if the and help to breathe. If there is if you have, you can give oxygen. If you have, must have to help. And the most important that to the suppurative, we cannot do something more. If we haven't any antidote with us in the possibility, we must have it in our group or some in place that we have. If haven't any antidotes, the most important to wash by water, to remove the clothes, to not to touch the clouds by others, maybe very dangerous poisons on the clouds, that and help the person to breathe. It's important. We cannot do so important to for the first aids that everybody must have to help the may maybe have the possibility of the not intubation, but open the respiratory somehow, and if there is bleeding, to help to stop the bleeding, and wash the eyes, for example, more than 30 minutes, but we must repeatedly wash by water, by the water that we have. And it's the most important that can we do. And the most important, that remove the patient from the place that attacked were done, that the place of the attack. Remove some, so I know, but it's difficult from maybe in the cave. We are in the cave, so have no any possibility to find a safe place. But if there is an open field, so it's better to move from the place of the bomb some distance. And if it's in closed area, so it's better to come from the closed area, because it's accumulation of the gas and the airborne toxic that is in vapor form. So it is important to have a fresh air. If you have more, so you can add Dr. Akram or other
نظام لازمه بگرین میتی ذاتن بحثا وکر بگشتی مرو نکاره شکی تایبت ببیجه کار دست پێکە وەکو ئەمە جل دەرخین یعنی دەبێ وی بکەین بلا هاتوچونە بهێنێ زێدەتر بێ ئۆکسیژن بدەین ئانکو لە ڕەوشێکە ئانتیدۆت هەیە مەسەن وەکو نێرڤ سیستم دیاسپام هەیە زاتن کیت هەیە وەکو ئەم بژین دەرزیەن تایبەت لەوێ دەرێ گەلێک کەسێن هەنە بە تایبەت هەونای عەسکەر جەمۆنا هەیە یعنی مرۆڤ دەکارێ ئەو دیاسپام وەکو ئانتیدۆت بکاربێنێ و زاتن
Washing.
بۆ هەندێک تشان هەیە مرۆڤ دەکارێت بشورێش بەس هەندێک تشانجی هەیە مرۆڤ نەکارێت بشورێ و ئەوە زاتن پاخشکردنە برنجی ئەدی هەون دەزان چاوەگی ئەگەر برینێک چێت
تو چشمم خیلی آب بریزن اگه چشم و صورت و اینا باید مرتب تا نیم ساعت هم میشه آب ریخت لازمه یعنی I talk Persian. It's important to wash it repeatedly, more than maybe 30 minutes in some cases.
Doctor, I have a question. May I ask my question?
Please.
Do you have any documentation or document about how much do these chemical wares affect different generation? Unfortunately, in different times, chemical weapons have applied by different governments. But I don't know, there is a document that how much these chemical weapons can affect different generations. For example, this year's chemical weapons applied in summer, maybe in the future years, maybe in 50 years or 100 years, another generation affected by this weapons.
Yes, I had more documents and hope to have another opportunity to talk about more details of that. And you can send, I send, you have this, please give to our friends in medical school and personnel that they may need it. But I have it in the next opportunity. I can have the more productions of the new productions of the new generation, as you mentioned. So we must have update information. So I tried to have these. I have written down it's like a very, very long. As Dr. Akram invited me in Germany, so I presented some more details. But I have very update, so I can send for you.
Thank you very much.
Please, you are welcome.
Ich werde zuerst in Deutsch sprechen. Ist mein Mikro gut? Говорите?
آره فهم.
Deswegen gesagt, man nie beobachten. Zunächst werde ich in Deutsch mich.
Please.
Ich werde mich bei allen bedanken, besonders bei Dr. Abbas Mansouran, bei Dr. Haidar, bei den Studenten, der Studentinnen der Universität Rojava, auch bei allen, die mit unterstützt haben, mitgeholfen haben, die zugeschaut haben. Unser Programm wird weitergehen und ich freue mich in diesem Zusammenhang mit den chemischen Waffen der Phosphor der Türkenarmee und seinem Einsatz in Çekên, dass die Türken dieses Fall dem jungen Mohammed im Oktober 2023 präsentiert haben, als ein Angriff der Israelis auf einen Jungen im Gazastreifen. Also es hat nicht gereicht, das Leid der Bewohner in Rojava zuzufügen, sondern auch deren Leid zu missbrauchen, als ob ein Einsatz der israelischen Armee in Gazastreifen war. Wir Kurden kennen die Waffen von Halabja, von Balisan und. Leider appelliere ich jetzt an allen, dass wir daraus Lehren ziehen. Die türkische Armee wird weiter chemische Waffen einsetzen. Die schreckt vor nicht zurück. Das Traurige dabei ist, dass die Bundesregierung hier in Deutschland diese Angriffe der Türkenarmee rechtfertigt. Die Regierung der Bundesrepublik Deutschland rechtfertigt die Angriffe auf Rojava als Selbstverteidigung der Türkei. Das habe ich aktuell am 2. Januar vom Außenministerium schriftlich bekommen. Das ist ein tragischer, trauriger Politik, die den Konflikt und Frieden nicht fördernd ist. Ich hoffe, dass niemand den chemischen Waffen mitbekommt, lebt und zuguckt. Ich habe die Patienten von Halabja mitbetreut, als sie nach Deutschland kamen. Ich weiß, was das bedeutet. Ich habe das Bild jener 10-jährigen Mädchen im Kopf. Ich hoffe, dass sowas, chemische Waffen, Landminen, immer und für ewig geächtet werden, verboten werden. Und da appelliere ich, dass wir in diesem Zusammenhang noch verstärkt arbeiten. Der nächste ist Dr. Goran, Radiologe. Er wird einen Vortrag halten. Danach die Dr. Jasmin aus Wien über Trauma. Und danach ein Kollege aus Ägypten über radikal Tachykardie Herzmanagement. از نوع کردی مخاطبم erlauben Sie mir, das auch in Kurdisch als das letzte Wort sage. Azur spas Dr. Abbas Mansouran, Azur spas Dr. Haydar und Dr. Simon Becker و همه ادبیات مارتی تجربه ما سپاسی همه برای همه سپاسی طلبه ما دکم اوانو مستقبل من من پیر بود هم کل بود بار ما خورا کر بس منی کنی سرگیشتو هیوی دکم طلبه ما بسرگینم چکی کیمین کردستان فقط یارو لدول بالستان حلبچه من بخور دار حلبچه بالألمانيا درمان کردن و هیوی دکم هم درس وجه دوی حالتی فسفوری دکتر عباس منصوریان پیشکش کریه تراجیک یعنی تشتی زور دیشه مرا و ترکو او حاله وی کرکی درخست و بلاف کر بخو گوت او جيش اسرائیلی غزل وی زوروکی خستیه به فسفور یعنی ایشک ما نباشه ایشک ما جهین ده تجربه از هیوی دکم اردوان و تا سال این سال 2024 پروگرام ما فوله کاردیاک محاضره هنه رادیولوژی دو هنه و سیشوزوماتیک و سیشات و تراوما دو محاضره هنه دکتر منصوریان عباس از هیوی دکم تبیسو آماده به ich hoffe, dass du nochmal für uns jemand da bist. Und ja, und ich hoffe auf ein vielen Dank und auf das Kommende. Wenn jemand Fragen hat, kann er stellen. Wir von der Internationalen Nothilfe, wir werden dieses Programm weiterführen. Wir sind jetzt im 2. Jahr. Besonders möchte ich meine Kollegin, Frau Dr. Koch, Dallendorfer danken, die ist jetzt in Nicaragua. Die konnte diesmal nicht dabei sein. Und unsere Simon, ohne ihn läuft nichts. Ja, und ich wünsche euch allen einen guten, erfolgreichen Wochenende. Dankeschön.
تمام دسته و سخت به سپاس ساعت و خوش.
سپاس شما.
Have a good day and
سپاس دکتر اکرم دکتر هیدر دکتر عالم مارتین افلو
thank you.